Cardiovascular Disease and Chinese Medicine by Robert Doane. Unfortunately, every 40 seconds, someone has a heart attack in the United States. Cardiovascular disease is the leading cause of death in the United States. Major risk factors are high blood pressure, high cholesterol, and smoking. In the world of cardiology, there are many different types of heart failure, but almost all of them are rooted in one main cause: restricted blood supply, nutrient supply, and oxygen supply to the heart wall due to coronary artery constrictions or blockages. Typical culprits include arteriosclerosis, which is a hardening of the coronary arteries causing lack of flexibility in the vessel walls. This lack of flexibility causes high blood pressure and risk of the artery breaking, resulting in a stroke or heart failure. If the broken artery is in the heart wall, it amounts to a heart attack, and if it is in the brain, it can cause a stroke, many of which are fatal. The second culprit affecting our coronary arteries is atherosclerosis, Atherosclerosis. This sounds like arteriosclerosis, but it is different. Atherosclerosis is swelling and plaque formation on the inside of the coronary arteries, causing a reduction in artery diameter and thus restricting blood flow to the muscular wall of the heart. The general public is told this is a cholesterol disease, but it is more complicated. Thoracic surgeons report that atherosclerosis is more of an inflammatory disease. Cholesterol is being sent to the site of the inflammation in order to cover up the swelling and heal it, as it were. Unfortunately, the buildup of cholesterol plaque reduces the diameter of the artery, often causing significant blood flow reduction to the cardiac muscle, easily leading to a heart attack. The plaque can also break off the cardiac wall, resulting in a local bleed, somewhat like a skin scab coming off. The bleeding immediately clots, and if the clot travels into the heart wall, it can cause a heart attack. If the clot gets into the arteries delivering blood to the brain, it can cause a stroke. Recently, another cause of coronary heart disease has been found, and it is called Takotsubo. That's spelled Takotsubo. Takotsubo cardiomyopathy. In this situation, the left ventricle of the heart becomes so misshapen that the heart's pumping action fails, causing a heart attack. This disease is said to have stress as its origin and is sometimes referred to as a broken heart syndrome. The theory is that when someone is under a lot of stress, the cardiac wall of the left ventricle can contract and elongate. The wall of the heart is in fact a muscle, and muscles can contract under duress. In addition, the coronary artery walls are also muscles, and they can contract under influence of stress also. Consequently, a patient can have chest pain and even heart failure without any signs of arteriosclerosis or atherosclerosis. In this case, stress causes the heart attack. This often happens when someone dies and a few hours later, the patient's spouse has a heart attack from the enormous stress of losing a loved one. Symptoms of heart disease in Western medicine include fatigue, shortness of breath, swollen feet or ankles, chest pain, fainting, and dizziness. Unfortunately, a patient often suffers a heart attack before Western medicine recognizes they have a heart issue. A recent study on approximately 6,000 Americans, average age 51 years, showed that approximately 60% of Americans have preclinical heart failure. Despite all kinds of recommendations as to diet and lifestyle, all kinds of blood pressure medication, and statin drugs, heart disease still remains the #1 cause of death in Western society. The American Heart Association admits that nearly half of the US adult population has some type of cardiovascular disease. What can be done? Regular doctor's visits and cardiac testing is vital to spot the disease before it becomes serious. A healthy diet is important, and of course, refraining from smoking. Can more be done? We think so. My name is Robert Doane, and I own and operate one of the largest Chinese medical clinics in the United States, the Acupuncture and Wellness Center, PS. We are located in Poulsbo and have been in business for over 20 years. It is not uncommon for the clinic to treat 70 patients a day. With such a large patient population, we encounter heart disease approximately 30 to 40 times a day. Can Chinese medicine help? We think so, but only as an adjunct to Western medicine. We put patients on weight loss plans, which we have found to be effective. Loss of weight can often reduce high blood pressure, improving the risk factor for cardiac disease. We use acupuncture to reduce pain, often a factor in high blood pressure, and we use Chinese herbal medicine to try and improve the overall health of the patient. In Chinese medicine, health can be described as highly oxygenated, highly nutritious blood coursing through the body. For this to happen, the heart pump has to be strong and the arteries have to be open and unobstructed. There are a number of studies on the efficacy of Chinese medicine and heart disease, but unfortunately, these studies are not rigorous enough to draw any real scientific conclusions. More studies are being done, but so far, Chinese medicine can only be described as complementary medicine with an emphasis on health.